For Vancouver East.
Thank you very much, Mr. Speaker, and I'm pleased to rise in the House today to debate this report. And I would like to let you know that I'm splitting my time with another member. And I would like to also state, Mr. Speaker, that I do find it much more valuable that we're debating this important report from the Standing Committee on Health rather than yet another time allocation motion that this government tries to push on the House. We've had now 29 time allocation motions in addition to 2 closure motions, as well as other motions that were simply designed to limit debate in this House. So I'm happy today that at least we are debating a report of substance that has to do with chronic diseases related to aging and health promotion and disease prevention that comes from the Standing Committee on Health and that was tabled in the House in May 2012. This is much more substantive work than trying to deal with yet another time allocation motion from the government. Now, Mr. Speaker, the report that we're debating today has to do with the very serious issues in Canadian society about chronic diseases as they relate to aging, but also to all people. And I would like to point out that the Standing Committee on Health had a very fulsome debate on this. We heard from witnesses from October 2011 to February 2012, and we heard very credible witnesses who told us that chronic diseases cost the Canadian economy about $190 billion annually. The committee was also told that the treatment of chronic diseases consumes 67% of all direct healthcare costs. Now, Mr. Speaker, that is a staggering figure, and yet how often do we talk about this issue and consider what the cost considerations are? Now, clearly, we need to have a healthcare system that responds to people's healthcare needs, but I think there's now a growing body of evidence that tells us that we need to manage how the system works, and we need to manage a lot better on disease prevention and health promotion. And if we did those 2 simple things, we would be saving the system billions of dollars. If we focus better on primary care, of making sure that people have access to a family doctor through a community health center, primary care that focuses on a multidisciplinary approach to prevent people from having to go to the emergency rooms or standing in line for hours and hours or going through procedures that might have been prevented because they had community accessible, community-based health care that was based on health promotion and disease prevention. Mr. Speaker, this is what the committee dealt with. As I say, we heard from a number of witnesses, and I do have to say that the report that finally came out was somewhat disappointing because, as I think we've seen with a number of committees, the government did everything that they could to basically make a committee report just sort of an A+ on everything that they believe that the government has done. In many cases, ignoring what witnesses had said in terms of what actually needs to be done to improve the system. So I am very proud that in this particular report, the NDP members on the committee also submitted a minority report and put forward what we believe were the clear suggestions and recommendations that came from the witnesses that we heard. And I would like to just take this opportunity to go through some of those very important recommendations that we put forward. And first and foremost, Mr. Speaker, we have to go back to the 2004 health accords. These were accords that were signed by the provinces, the territories, the federal government, and laid out a plan for 10 years about how we would approach our healthcare system. And I think they very much built upon the Royal Commission that was conducted by Mr. Roy Romanow and his report of 2002 that was called Building on Values, the Future of Healthcare in Canada. That came out in 2002. And if we go back to the health accords in 2004, we can see that there were some agreements. There was a consensus that was arrived at by the provinces, the territories, and the federal government about what needed to be done to refocus the priorities of our healthcare system and to make sure that we were getting healthcare services and support to people earlier instead of waiting for the onset and management of chronic diseases. And in fact, one of the key recommendations that Mr. Romano made way back in 2002 was to have a home care program. Again, we can see the reality today that there are many seniors who are either living alone and without the necessary supports. They often end up in emergency rooms. They end up in acute care, when they should be getting that community-based support and care, including home care. I mean, Mr. Speaker, it seems to me that these are very logical provisions that should take place. So it was very disappointing for us when participating in this committee and the report that was done to find that a number of these key recommendations were ignored by the government members, and it was up to us to bring them forward. So that was a key one, was to actually go back to the Romano report and to look at what he had so soundly put forward about what needs to be done, and a key one being home care. Another issue, Mr. Speaker, that was clearly agreed to by the provinces and the territories was to implement a national pharmaceutical program. We know that there are many, many Canadians who are finding the exorbitant cost of prescription drugs to be something that is now very unaffordable to them. It's something that is one of the key indicators of rising costs in our healthcare system, is the cost of prescription drugs. And again, it was interesting to note that in the 2004 Health Accord, there was an agreement that this would be worked on, that we would come forward with some kind of national program that would make sure that prescription drugs were affordable and accessible. One of the most obvious things that could be done was to make sure that all levels of government work together for a bulk purchasing plan for prescription drugs. It's been estimated that that would save us about $10 billion annually in our healthcare costs. Just imagine that. I mean, we are talking about very big numbers here. So this was, again, a very key recommendation that the NDP put forward in this report on chronic diseases, because we understand that the need to address some of the inequities in the system and some of the incredible costs that people are facing, for example, with prescription drugs, is something that needs to be worked on. It's an area of work that we've seen the federal government basically walk away. And in fact, when you look at all of the accords, the agreements in the accords from 2004, and you look at an examination and an analysis of what has actually taken place since that time, the most obvious and glaring thing is the fact that the federal government has basically abandoned the recommendations and the agreements that were made in that accord. So is it any wonder that we're now facing higher and higher costs for chronic diseases, because we're not paying attention to what it is that we need to do in our healthcare system, and we're not paying attention to what was actually even agreed to back in 2004. So it has been very disappointing to see the failure of federal leadership in this field. Not only have they not shown the leadership that's required on the accords, but then we had an incredible situation last year where the Minister of Finance unilaterally came out with a funding formula for healthcare that, as we know from the Parliamentary Budget Office, will shortchange provinces and territories by over $30 billion in the long term. I mean, this is very shocking information, Mr. Speaker. The fact that it was unilateral, usually this is a matter of discussion between provinces and territories and the federal government in terms of what those health transfers will be. The fact that the Minister of Finance made a unilateral decision, and then we saw the Minister of Health and the Conservative government as a whole basically say, you know, it's not our business. It's up to the provinces what they decide to do. Well, Mr. Speaker, I want to be very clear in this House that we in the NDP understand that healthcare is a federal responsibility under the Canada Health Act. We understand that there has been a very strong role for the federal government. It is absolutely correct that provinces deliver healthcare, but the role that the federal government plays in terms of transfers, in terms of showing leadership to bring about agreements such as we saw in the 2004 Health Accord. This has been a very important role for the federal government to play. And the fact that now we have a Conservative government that has completely abandoned this responsibility, I think presents us with a very serious situation. Mr. Speaker, I want to end by saying that one other area of the report that we highlighted on was the lack of action by the federal government in dealing with the recommendations that came from the working group on sodium reduction. And I want to mention this because it was really, again, shocking to see that there had been an expert advisory group. The provinces and the territories even agreed with the recommendations. And lo and behold, it was the federal government that disbanded the group, that moved away from the recommendations and basically, again, abandoned its leadership. I'm very proud to say that we in the NDP have now tabled a bill, Bill C-460, that, if approved, would implement the sodium reduction strategy that was put forward in good faith and worked on for so many years. Again, this is a very critical issue around health promotion and disease prevention. It's an issue that affects those with chronic diseases. So this was a very important recommendation in our report that we will continue to work on. Thank you, Mr. Speaker.
Comments, questions et commentaires.
Questions and comments.
Member for Algoma, Manitoulin, Kapuskasing.
Thank you, Mr. Speaker, and I greatly appreciate the comments from the member who happens to be the critic for health for the NDP. And you know, when we heard the minister, the finance minister earlier today, say that they've put all this exorbitant amount of money and the more into transfer payments, and with respect to the health accord, and he's saying that there won't be any cutbacks. And the member is absolutely right. There will be massive cutbacks in health care. So when we're looking at that, maybe I'm just wondering if she could kind of elaborate with respect to, with an NDP government, what people with chronic illnesses and would actually expect from this government with respect to funding and with respect to prescription drugs.
Mr. Speaker.
The Honourable Member for Vancouver East.
Well, I thank the Honourable Member for her question. And in actual fact, the NDP launched a national campaign in September of this year where we're now going across the country consulting and speaking with Canadians in terms of public health forums. We're holding expert stakeholder meetings. We've had an incredible response, and it's really quite ironic. We face a government that has actually refused to talk to Canadians about health care. As I said, they've walked away from the table. They don't consider it their responsibility, and yet the response that we're getting out in local communities, and in fact, if you look at the polls from the Canadian Medical Association, the number one issue that Canadians has is for the federal government to take leadership on health care. So this is a government that's going in completely opposite directions as to what Canadians want. And I appreciate the member's comment, because what we're hearing from Canadians when we go out in our public forums and talk with people is that this issue of drug costs and how they are so high for so many people and unaffordable is something that is now very serious. And we even have situations where, for example, a cancer patient in New Brunswick who's paying an average of $60,000 for cancer drugs is being urged to move to British Columbia where those costs would be covered. So you can see the inequities across the country. There are provinces that are working very hard, like Nova Scotia, like Manitoba, to deal with this, but it's not within the framework of a national collaboration around drug costs. So I think the member is right on when she raises this as a very specific question, because I think it is one of the key concerns that Canadians have. And, you know, it's really very, very bothering to me that there is so much that the federal government could easily do from an economic point of view of saving billions of dollars, but also from a social equity point of view in terms of making sure there aren't these inequities in our healthcare system, and yet they've walked away. So this report today that we're debating, Mr. Speaker, is an opportunity for us to focus the limelight on some of these key questions and to make it clear that there is a progressive vision for healthcare in this country, and it's coming from the NDP.
Questions and comments. Questions et commentaires. The Honourable Member for Vancouver Centre.
Thank you very much, Mr. Speaker.
I want to suggest that, in fact, the Liberal Party had tabled a dissenting report to this report for all of the reasons that were spoken of here today by the NDP. But I think one of the most important things is this. The life expectancy of Canadians was 80.9 years. We were at the top of the world charts in terms of life expectancy. That is now dropping. Life expectancy in Canada is now dropping, attributed to chronic diseases such as diabetes, to childhood obesity, to cardiovascular disease, to all of these chronic diseases which are preventable. And the Minister of Health has the federal government has a clear responsibility to prevent disease and to promote health. And it isn't good enough to say we like to do it and then do nothing. The thing that is wrong in our dissenting report, we stated in this report, is that we heard from every witness who presented to this committee. They had clear recommendations and they all agreed on the recommendations. These were experts, and the government's report does not contain a single one of those recommendations made by witnesses. In fact, I would like to ask the honourable member if she does not think it has actually become a farce. When expert witnesses come to committee, they present clear, concrete, factually based and evidence-based arguments. They bring recommendations to support the right thing to do to stop this slide in longevity in this country, to stop chronic disease, and the members of committee continue to block it from the government side, so witnesses waste their time bothering to come. It's a disrespect to witnesses, and it does not show any kind of care in part of this government or this minister to protect the health of Canadians in this country and to prevent disease and to promote health, which is what this report should have been about, and it isn't. It's a whitewash report. It says nothing and it does nothing.
The honourable member for Vancouver East.
Well, Mr. Speaker, I thank the member for her lengthy comments, but I do want to say that she's entirely correct that both the Liberal Party and the NDP, we put together minority reports because there was such a high level of frustration at the committee that what ended up as the main report really did not contain the flavour and the impetus that came to us from many of these great witnesses that we heard. And I think, again, it's not just our committee. I know that this is being felt across a number of committees, in fact, probably all committees. And it's very disturbing that we now have within this Parliament a government that is so intent of being non-transparent, non-democratic, hiding from the truth, squashing debate, squashing the testimony of witnesses, and making sure that these reports that come out are basically just sort of a whitewash and lauding the government. I mean, that's not the way Parliament is meant to work. So I'm very proud of the report that we put together, because it totally zeroes in on the very key issues that we need to address when it comes to dealing with chronic diseases as it relates to aging, and what we can do in a positive sense to make our healthcare system affordable, high quality, accessible to every Canadian, no matter where they live, and to make sure it's a public healthcare system.
Resuming debate.